Dr. Sabby George, welcome to the Valder Beebe Show, and you too, Audrey Davis. Thanks for being here.
Thanks for having us.
Thank you.
I want my audience to know I'll be talking to Dr. Sabby George first. He's a medical doctor and a professor of oncology at the Department of Medicine at Roswell Park Comprehensive Cancer Center in New York. Dr. George, you have a big job being an oncologist. I can't imagine how busy you are today with how many cancers I just get to hear on this show. Tell us about a new treatment that you want us to know about.
So the new treatment is a novel method of delivering immunotherapy called the subcutaneous administration. Subcutaneous administration means injection under the skin, and this has emerged as a novel method of treating cancer, various cancers. And it may offer flexibility to receive treatment where it's best for the patient and healthcare providers. And, historically speaking, immunotherapies were given intravenously, and now this subcutaneous injection method may provide time savings and reduce administration time, and thus potentially making treatment more accessible for patients. So those are basically the highlights of this treatment.
When you're saying it's going to reduce time or create time saving, are you talking about for the facility or for the patient?
It's particularly both for the facility and the patients, because you can free up infusion chairs, and Audrey can tell you a little bit more about it if I can punt the question back to her.
Yeah, Audrey, let's segue to you. Tell us about, who's it going to save time for?
Absolutely. So, as Dr. George already mentioned, the traditional method of delivering immunotherapy treatment was through intravenous infusion. So those infusion centers that you're familiar with, those can have long administration times as well as limitations on where patients could receive that treatment. And in certain cases, it was actually disadvantageous because they required placement of a port on the body in order to receive the IV infusion. So now when we're talking from, cancer support community, we represent not only the patient, but also the caregiver perspective. It's not only that decreased administration time for the patient, but also possibly their caregiver or care partner waiting for the injection to be fully administered. Dr. George can talk a little bit more about the differences between the traditional IV infusion and the new immunotherapy in terms of actual injection time and what this means for the patient, and how, times at the clinic might vary, but in terms of the administration for the injection, definitely less time involved.
Thank you, and thank you for knowing so much about your job as a patient advocate. Doctor, I'd like to ask you, tell me about the treatment options, because it seems like technology is giving the patient more and more options.
That's very true. So the novel treatment is called Opdivo Qvantig. This is an immunotherapy called nivolumab in combination with hyaluronidase, approved for injection under the skin or subcutaneous route. FDA approved this for various cancers, excluding pediatric patients and Opdivo-Yervoy combination regimens. And this was approved based on a study called Checkmate 67T. I was also a principal investigator of that trial, which led to the approval. And this treatment is the first and only subcutaneously available PD-1 inhibitor, which stands for programmed death 1 pathway inhibitor, which is an important aspect of treating various cancers. And this treatment is given over 3 to 5 minutes as an injection under the skin versus traditional 30-minute infusion time for immunotherapy given intravenously. And when we talk about faster delivery, we're specifically talking about injection time, which does not include other aspects of treatment, and clinic time may vary from place to place, etc. And as you know, every treatment has risks, side effects, etc., and every patient is different. Some may experience tiredness, rash, pain in the muscle, bones, joints, etc. And also, every patient is different, so patients should discuss with their respective doctors as to what's best option for them.
Doctor, let me ask you, this will be my final question for you. If you could look into the future, do you see the patient being able to give themselves their own injections?
Well, that is, at this point, this is a little stretch, but I think that could be a future. At this time, injection is still being planned for given by clinics. In future, I don't know if it might become available like a, insulin injection, etc. But the problem is, patients still have the side effects from these treatment. Immunotherapy is tough treatment, and they need to be assessed by physicians and nurses and nurse practitioners. It's very important that the safety is assessed.
Okay, and the reason why I asked is one of the posters on Instagram said it's not the same drug, but they not even the same condition, but their allergists, they started off only the allergist could give it over a 2-year period of time. Then they had the option that the allergist give them the shot, or they could do the shot self-administered at home. So I saw an evolution there in her question. So, poster, hopefully that answers your question. Dr. Sabi, Dr. George, thank you so much. I'm going to wrap up with the advocate. I'd love to know where we can go online and get more information.
Absolutely. So if you want more information about this immunotherapy that we talked about, it's qvantig.com, QVAN as in Nancy, TIG.com. If you want more information about the 100% free, no-cost resources that Cancer Support Community offers, including at your local network partner, Cancer Support Community North Texas, you can visit cancersupportcommunity.org. I did want to thank you for allowing us to be on the show with you today. We are really excited about this partnership with Bristol-Myers Squibb because it does give patients that increased flexibility with being able to receive treatment outside of traditional hospital settings that we talked about, and also the decreased administration time, which, as I noted, is nice not only for patients, but also the caregiver involved as well.
I want to thank you both for coming on the Valder Beebe Show because when I told them that Dr. George was coming on, a lot of people had a lot of questions about cancer. So it's something that people obviously need more help on. So I thank you both for taking the time to be my guest on the Valder Beebe Show.
Thank you.
Thank you, Valder.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebeShow. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/ValderBeebeShow and stay connected as I interview the world's most fascinating people.